Okay, very good morning to respected director sir, ISF College of Pharmacy, and IQAC dialogue series, which is going on under the blessing of our director sir. And today's speaker, Dr. Asheesh Kumar Gupta, who is a professor in the School of Pharmaceutical Sciences, IFTM University, Moradabad, UP. So I welcome you, sir, and thank you that you have accepted our invitation in a very short course. So Dr. Ashish, who is working as a professor in the Department of Pharmacology, and he has more than 30 research and peer review papers. He had published more than 5 books, as well as he is one of the author that he developed one of the software for the animal studies. As we know that CPCSA do not allow us to use the animal up to the B form or M form level at the initial time. So that's why Simcology software, which is being developed by Dr. Ashish Kumar Gupta. So I congratulate you, sir, that you have developed a wonderful software so that
Thank you.
everyone can good and get the knowledge. So, without taking much of time, I request our director, sir, please, sir, bless us with few words. Thank you.
So, thank you very much, Dr. Samsherji. First of all, I welcome today's one of the dynamic and very down to earth Dr. Ashish Kumar Gupta ji from core of my hearts from ISF College of Pharmacy as well as ISF Dialogue Series. I also welcome all these professionals, those who are the connect with this ISF Dialogue Series. So, I know today is the very important day of the Dr. Samsher Singh ji. So, on behalf of ISF College of Pharmacy, I want to give you lot of good wishes on your birthday. So, happy birthday with a lot of good wishes. You can grow and grow
Thank
in
you,
your
sir.
life.
Thank you.
My wishes to you. And without taking time, I just want to give the information. Dr. Ashish Kumar Gupta, as you know that in those days pharmacy profession is growing very fast. Considering this, ISF college start the ISF dialogue series to connect some of the people, those who are doing the work and the excellent in their field. One of them, you are the expert, so I hope that today's talk it will be very useful to all the professional academician and researcher. So thank you very much, Dr. Ashish ji, for accepting our invitation and provide your very precious time in this ISF dialogue series. So thank you, coordinator Dr. Samsher Singh ji, to provide the opportunity to interact with you. So thank you very much. Without taking time, over to Dr. Samsher.
Thank you, sir, for your valuable word. I just convey to all the audience that today Professor Ashish Gupta, he is going to deliver his talk on the principle and the basic concept of toxicology, and hope this information will be very useful to all. At the end of the lecture, anybody can ask 1 to 2 questions so that there will be a mutual discussion related to the topic. I welcome you, sir. Please you share your screen and continue your lecture. Thank you.
It's my privilege, Dr. Professor Gupta, to address this online series. And let me start with a formula. Is my screen is visible, sir? Some
Sir,
says
it is not visible now. Just I think so. It is in process of sharing. Yes, now it is visible, sir. You can continue, please.
fine. Yes, we are talking about the toxicity as the assignment given by Dr. Samsher to me. Toxicology is a very important part of our pharmacology. As we know that this is a very important branch of pharmacology because every dose and every chemical or every substance has limitation to dose. Or actually, in fact, all the drugs are poison if they are not used properly. Means what is poison? This is very important to understand. Any substance or any chemical or any drug that may be poison if it not used in proper dose, proper timing, and proper prescription also. If it is used properly, then it may behave or it may act like a drug. If it is not used properly in proper proportion, proper combination, or proper dosing, and on the proper timing, then it can act like a poison. Then what is toxicology? Toxicology is a field of science that helps us understand the harmful effect of chemicals, substances, or situations. Situations also can produce problems, can have on people, animals, and to the environment. Substances, those are toxic, may affect people health, animal health, as well as to the environment too. Some refer toxicology as the science of safety because if people have proper information about the consumption of substances, then they may be living more safe life rather than the normal or because it evolved from a science focused on studying poisonous and adverse effects. Toxicology uses the power of science to predict what and how chemicals may cause harm and then shares that information to protect public health. Because we are related to public health services, so we are to grasp knowledge as well as to share the knowledge among the society to for the safe and good life. Then what would be the applications of toxicology? After this application, I will discuss in detail what is poison, what is type of poisoning it is. So, related to poisons, dose is very important for any substance. As I earlier told, all the drugs are poison if they are not used properly. Dose is very important. Means if we talk like paracetamol, a limited dose of 500 or 650 may be a therapeutic dose. It can treat the problem. It can reduce your pain and fever. But at a higher dose or around 12 gram of paracetamol may be lethal dose or it can kill a person. Or in higher doses, less than 12 gram or more than 650 gram, it can be a subchronic or chronic toxicity or poisoning. So dose determination is very important related to drugs and poisons. Poisons are those substances that are very lethal or very harmful at lower doses too. Drug poisoning, excess amount of drug in the body cause toxicity. So it is very important to understand through toxicology that what is the appropriate dose and what is the excessive dose of that drug. It can deteriorate your body or it can harm to us or it can produce adverse effects or what is the actual dose of that drug which will be beneficial to us or it will be therapeutic dose. Toxicological screening as during screening of any toxicological events or episodes, we take some samples of blood, urine, or saliva. Urine samples are very frequent to evaluate or to understand what type of poisons might be producing toxicity or poisoning episode. So this is also a part of toxicology that how to determine what is the agent which is causing toxicity. And drug safety is very important as a part of our preclinical studies. We also determine lethal dose and LD50 median lethal dose and what is the safe dose to give to animals or to the human beings for drug safety purposes. And health safety, this is a very important parameter and it gives awareness and information to regulatory agencies and others to make a scheme about public health services and to plan that how to plan a program which will be helpful to the society and it gives awareness and public health safety. Then what is poisoning and poisons? Poisoning can be defined as a chemical injury to the body, organs, or a chemically induced disturbance of the functions in biological systems. Such toxic effects may follow the exposure to exogenous environmental substances. Any substance may be poison. If it is in limit, it may be beneficial. It is exceeding the limit, it may be poison, or some substances are not useful to us, but in trace amount or very little quantities, it can produce toxicity at organ level or at a systemic level or to the entire body. It can malfunction or physiology, it can deteriorate or anatomy, or it can produce some lethal effect to the particular organ like liver, uh, cardiac, neurons, or something else, or it can produce harmful effect on the entire body. So any substance which is producing deteriorating or harmful effect on our body in a trace quantities or little quantities, that is poison. And poisoning is a chemical injury produced on our organ or on body, or it can produce chemical changes in our physiology. Poisoning may be three types. It may be accidental poisoning, it may be deliberate poisoning, or it may be suicidal poisoning. Accidental poisoning means you don't know about the what is the cause present surrounding us. Accidentally we come in contact with them and we ingest them and we suffer. Deliberate means जानबूझ के करते हैं. We know opium or marijuana or some antidepressant drugs, some narcotic drugs are harmful. After knowing all these informations, we consume them and we come in contact with them and we use to those drugs and we become addict, drug habituation, and after all, it produces chronic poisoning. So drug abuse and drug addiction comes in category of deliberate poisoning, and overdose of that drug can produce acute poisoning too. And suicidal cases are very often. Suicidal poisoning means people used to consume harmful substances to kill himself or herself. By tradition, an agent has been considered as a poison if may damage the organism in a very small dose. If any substance is injuring us in a very limited small dose, then that substance is considered as poison. The toxic properties of a certain poison are often specific and hence the clinical symptoms after exposure to a poison may be quite characteristic. Every poison has its characteristic changes or lesions in our body. Substances that are normally considered as harmless also, if the dose is being enough, cause deleterious effects. Like normal sugar, sodium chloride, oxygen, if it is consumed in overdose, then it can also produce some deleterious effects on our body. The science devoted to the study of the structure, effects, and fate of poisonous substances is called toxicology. This is nowadays a wide, heterogeneous, and rapidly expanding discipline. Poisoning may be acute poisoning. Acute poisoning means exposure in short duration and in heavy dose, which produces in short while. Acute poisoning, the body is exposed to the toxic substances high dose on one occasion and during a short period of time. Symptoms of poisoning develop in close relation to the exposure, like massive drug overdose, poisoning after mushroom meal, alcohol poisoning, and venomous bite, stings, etc. Or mixture of drugs with alcohol, like paracetamol or NSAIDs, that also acute poisoning. Chronic poisoning means slow poisoning. In chronic poisoning, the organism is on contrary exposed related to toxic agents during a long period, but every exposure means just low dose of the poison is entering the body. Normally, no symptoms develop in relation to each exposure, although that may happen. In chronic exposure to the solvent, instead the patient gradually becomes ill after a long period of time. It may take 6 months, 1 year, 2 year, or 5 year, 10 years. It may depend on the properties of exogenous substances people are regularly using or ingesting them. In chronic poisoning, the toxic substances may accumulate in our body tissues or cause a small irreversible damage at each exposure. Means like in case of heavy metals poisoning, we used to take heavy metals in the form of in mixture of our food, meal, and water. It accumulates in our body or in body parts or in our tissues or cells, where when the quantity is sufficient to produce toxic effects after a while or after a long period of time, so, quantity of toxins is very much in our body, then it can produce failure of organs. Like, for example, long-term exposure to heavy metals, lead, mercury, cadmium, inhalation of organic solvents, occupational taxes, contacts, etc. What is the incidence of poisoning in India? The exact incidence in this problem is in our country remains uncertain, but it is estimated that about 10 to 15 million, means 1 lakh to 1.5 lakh cases of poisoning are reported every year, on which more than 50,000 dies, means 40 to 50% mortality is reported. Suicides in India, 6,300 suicides per annum. Out of that, 50% deaths are reported in young peoples. 140 million, 14 million attempted suicides or parasuicides, most common in age group of 15 to 19 year. All females usually exposed to them. Most common method is of poisoning is 50% paracetamol. Paracetamol poisoning is very common. Acute poisoning in emergency department, common 3 to 5% of everyday attendances. 2,000 deaths per year. Some of the highest rates of deliberate poisoning in Europe, often multiple drugs. Multiple drugs is a very common type of toxicity or poison. Treatment steps for effective management of an acutely poisoned victim. 6 contemporary steps are required. These are termination of exposure, whatever substances we have exposed, or we are in an industry or a premise where toxic gas is there. So first approach is to terminate the exposure. First evacuate the person from the atmosphere where toxic gas is there, then produce resuscitation or initial stabilization. Give open space, free flow of air to inhale or to respire with the normal air, and try to them stabilize with the actually person is in anxiety after exposure to a toxin, that he is in threat of life loss. So stabilization is very important by moral stabilization or life support. Diagnosis a type of poison, what type of poison he may be exposed to that. Then at the time of poisoning, the people's victims and witness can help you in diagnosis of type of poisoning, that what type of poison he has been exposed to. So diagnosis of type of poison means from the victims, from the witness, from the relatives, or by chemical investigation we can understand, or we have to identify the type of poisoning. Non-specific therapy, there is a series of therapy which is provided to the person, that is non-specific therapy. It does not include antidotes. If we are using antidotes to treat a person with antidotes to cure, then it is called specific therapy. Supportive care, after during and after the treatment, there is need of supportive care. Means we can talk, we can give information, or we can give moral support. We can counsel the person if it is a case of deliberate or suicidal poison. So it is general management step one. There is trick I have implemented here. A, B, C, D, E, F, G. A is airway, control the airway. If there is a gathering of big people around the victim or around the person suffering to the poisoning, so crowd should be removed, or give free flow of air or open space. B is breathing control. Check whether victim or the poisoning patient is taking breath or not. Breath is regular or not. If breath is not there, then we can go for CPR. Third is circulation. Check the circulation, whether blood circulation is normal or not. If blood circulation is not regular, then we can again practice CPR as well as shift the person as soon as possible to the hospital facility. This disability check for any kind of disability, whether person is able to see, his eyes are properly working, his skin is properly working, his legs, and if there is any kind of paralysis symptoms in the person's body. So try to check for any disability in the person's body. And DEG, fifth step is DEG. Don't ever forget the glucose. Immediately give glucose to the person. That helps in every case. Glucose is needed. It gives instantly, it provides energy to the person. Get a set of basic observations and immediately shift the person to the hospital facility as soon as possible. General management to use all the senses, search for the clues, for the type of poison, search nearby, whether if any suicidal case, then certain or bottles and take with them along with them to the hospitals to show the doctors these are the syringes, these are the bottles, these are the empty blisters or packages. It was nearby the victim. So doctors will be looking them and he can see or he can decide what type of poisons victim may be used. Look for track marks, pupil size, feel the temperature and sweating, and smell if alcohol or any solvent. These are the symptoms for several kind of drugs and what are the relative symptoms or sign and symptoms which is shown by if it is a chloroform, ethanol, cyanide, arsenic, then it can be observed by breath, odor of breath. If there is hypertension with tachycardia, then substance may be amphetamine, cocaine, LSD, MAO inhibitors, marijuana, phencyclidine, alcohol withdrawal, or something else. If there is hypotension with bradycardia, then the drug may be antidepressants, barbiturates, narcotics, benzodiazepines, cyanide, etc. If there is hypotension with tachycardia, then it may be aluminum phosphide, antipsychotics, caffeine, cyanide, disulfiram, ethanol interaction, etc. If there is hyperthermia, rise in temperature, then the drug might be amoxapine, amphetamines, antidepressants, cocaine, etc. Hypothermia or decreased body temperature means the drug might be antidepressant, ethanol, benzodiazepines, narcotics, etc. Tachypnea, if respiration rate is increasing, then the drug might be atropine, cocaine, amphetamines, salicylates, carbon monoxide, cyanide, etc. If bradypnea decreased respiration rate, then antidepressant, antipsychotic agents, barbiturates. Altered sensorium, then these are the drugs. Seizures, यदि epilepsy जैसे symptoms आ रहे हैं तो antidepressants, antipsychotics. If there is meiosis, pinpoint pupil size or pupil size is very small, then barbiturates, phenytoin, ethanol, or it may be morphine, codeine, or opiate poison. Mydriasis, then amphetamines, caffeine, cocaine, LSD. Cyanosis, methaglobin, terminal stage of oil poisoning. Specific management options, use of antidotes. I am giving you the list of antidotes that are usually given. First approach, actually these specific management options are implemented in hospitals where first approach is done if one person is engulfing the drug or any poison by oral route, then we can do some approach in decreasing the absorption of drug from gut to the blood circulation by giving a intubating charcoal slurry, which inhibit drug absorption or which slow down the drug absorption in systemic circulation. Because what is the extent of drug reaches to systemic circulation, which it will be showing the symptoms of poison. If less amount or if slow absorption rate or less amount of drug is transferring from gut lumen to the systemic circulation, then less effect or less symptoms of poisoning may be seen. So decreasing drug absorption, gastric lavage, हम वॉमिटिंग करवा सकते हैं. Never epecacuna. Epecacuna is sometimes recommended for inducing vomiting. We can give absorbents like activated charcoal. We can increase drug elimination. Whatever the extent or amount of drug has already transferred to the systemic circulation, which is showing effect, that can be eliminated out by giving diuretics or hemodialysis like approaches. Multiple dose activated charcoal, quinine, phenobarbital, charcoal hemoperfusion, barbiturates and theophylline, alkaline diuresis, aspirin in case of aspirin, and hemodialysis in case of aspirin too. We can give ipecacuanha syrup to induce vomiting. Soapy water can be intubated. Don't use finger gags, salt water, and copper sulfate because these substances itself may produce further toxicity. Specific management option 3, antagonizing the effect of the poisons. There is a list of antagonists or antidotes. The substances which are used to antagonize the effect of poison is called antidotes. Like in case of iron poisoning, dexperomoxime is used as an antidote. In case of opiate poisoning, naloxone is used as an antidote. In case of paracetamol poisoning, N-acetylcysteine is used as an antidote. In case of paracetamol poisoning, this is the commonest type of paracetamol poisoning. 12 gram is a fatal dose or lethal dose. 12 gram, if any person consuming 12 gram paracetamol at a glass or at a time, then it will be a fatal or it will be a lethal dose. There is around 100 to 200 deaths per year due to paracetamol. This is the list of antidotes. In paracetamol, antidote use is N-acetylcysteine. Vitamin K antidote is warfarin, opiates, naloxone, iron, heavy metals, desperomoxane, benzodiazepine, fluorogenil, ethylene glycol, ethanol, methanol के केस में ethanol भी दिया जाता है. In case of cyanide poisoning, amyl nitrite. In case of organophosphorus poisoning or insecticide poisoning, atropine is used. In case of magnesium poisoning, calcium gluconate is infused. Calcium channel blocker, calcium gluconate, beta blockers, calcium gluconate as antidote. In case of isoniazid poisoning, pyridoxine. In case of atropine poisoning, physiostigmine, that is a cholinergic drug, or that is infused. Thallium poisoning में Russian blue. Hydrofluoric acid poisoning, the antidote used is calcium gluconate, and anticholinergic drug poisoning, the antidote used is cholinergics.
Thank you, sir, for your wonderful talk regarding the pharmacology and toxicological methods or some of the drugs which are responsible to produce toxic effect on the human being and what are their antidotes. So, if there is any question from the any student side, then you are welcome to ask any questions. So I hope so that sir they understand all the aspects what you have discussed or either they don't learn anything. So response indicates. So, but I found that your lecture was very good, and you have discussed many of the things like
Thank you,
the
sir.
dose of the drug, which is responsible to produce the toxic effect. And thank you very much, and welcome to you again to ISFCP IQAC dialogue series. I hope that in future we will also take your services and exposure toward the student side. I welcome you. Thank you very much, sir.
Thank you, sir.